Weather is going to be the conversation for a lot of today, and we're talking about the fact that just got the news that the University of Missouri is going to close its campus at 1 today. Classes haven't started yet, so it's not going to be that much of an impact. It's not like 20 or 30,000 students all of a sudden are going to find out that they're going to be out early, but it is going to be a early closing for the University of Missouri campus. Well, let me do some introductions here, and I'm going to need some help in doing that. Tracy Bocklage, it's good to see you again. How are you?
Good, David. How are you?
I'm doing well, also from MU Healthcare. And then go ahead and introduce the rest of the persons that you have brought with you
This
today.
is Heather Jones, and she's an educator at MU Healthcare, and Amy Huff is an ED supervisor.
Amy Huff, it's nice to meet you also. You can pull up to that. I have not used in anything that I've done yet that microphone, so it's going to be fun for me to be able to use that one for the first time. Well, Tracy, you're here because, as I got word, there's a new program at the MU Healthcare that helps, as I understand it, identify potential victims of human trafficking. Is that correct?
That's correct, yeah. And we launched this program because we felt like we were seeing patients that were victims of human trafficking, and we didn't have a standardized planned response to that.
So what would be an indication that a healthcare worker would say, I've got concerns about the background of this person? I guess she's turning to you, Heather. So.
Sure. There's a variety of indicators or red flags. There can be physical, behavioral, history. They may present and not know where they are, what city they're in. They may be dressed inappropriately for the weather. Physical signs, you could see signs of abuse. And then behaviorally, they're going to be reserved. They may not want to make eye contact. So similar to what you would see in a domestic violence case, too.
Do you see this a lot? I mean, some of us over the last several years have learned more about human trafficking. 5 to 10 years ago, I couldn't believe that it was still an issue. It's kind of like modern day slavery is what it is.
Exactly.
But I guess it happens a lot more than many of us think that it does.
Well, the national statistic is almost 88% of sex trafficked victims were seen in a healthcare setting and did not receive help.
Amy, how do you fit in on this? I mean, your work, if I remember what Tracy just said a moment ago, you'd be like one of the first maybe to see people that you would have a suspicion that maybe something is wrong.
Yes, I work in the emergency department at Women's and Children's, and we do see ones that we consider red flags, but we've never had anything in line. I'm also a pediatric sexual assault nurse examiner as well, and that's kind of how I got asked to join in the group as well, because I kind of have two roles.
So what is the program? What are some of the details? What would help meet this need should it occur?
Well, a big part of it is education for staff so that they can recognize the victim. And then once they recognize them, what do they do? So we've developed a policy and then a nice short one-pager algorithm that they can follow if they encounter a patient.
What are a couple of things that they would have to do? Is it similar to if someone came in and said, I'm a victim of a sexual assault? Is that similar, or is it broader or narrower?
I think it's similar, is my understanding. But basically, once you recognize, there are a series of evidence-based practice questions that you would ask to determine if it is human trafficking or not. And then from there, the main resource that we offer is the National Human Trafficking Hotline. It's just a phone number that you can call and they'll connect you.
And Missouri has its own human trafficking network also, and I've talked to Nanette Ward many times about that, so I know that she is very conscious of this and probably is a resource that would be valuable in talking to people who are going to be dealing with this. Something, I mean, it's probably been around for a long time, but it's probably something that the awareness of hasn't been until the last few years.
Sadly true. That's a true statement.
So when you're, Amy, talking about, you mentioned pediatrics, so you're talking about children. Mm-hmm. I would hate to think that this is something that we'd have to be even concerned about with children, but obviously it must be.
Unfortunately, it does happen with children, and it happens with children more than we are even aware of. Statistics show that it's severely underreported for both adult and pediatrics. When it comes to pediatrics, if we're concerned human trafficking, it's a little different than the adult world because we are mandated reporters. So if we suspect human trafficking, we hotline it right then and there, and we do our best to essentially take that child into custody, whether law enforcement or children's division does it, but we hotline it.
What would you see in a child that might be a victim of human trafficking? I would think immense fear. I would be one of the things that I would think they would show.
Sometimes they don't, because a lot of times they're groomed from a very young age. And so they're very trusting in their trafficker because that's how their trafficker shows them love.
That's just a shame. I mean, and they're using them for, I guess, child porn and also for other things that I don't even want to talk about.
Correct.
If somebody is in the public and they have a suspicion that this is going on, do we call healthcare or do we call law enforcement? What would be the better advice there?
I would call law enforcement as well as report it to Children's Division.
And then let them, and it might end up where somebody on the healthcare side is going to be doing some evaluation.
Mm-hmm. Yes, once they're reported to Children's Division and we get concerned about any kind of sexual assault, they get a sexual assault exam.
Tracy, are you distributing this to all healthcare givers within the region? I mean, is this something that is on a national level, something that is becoming more common?
So we are on the forefront, we feel like, because it is a problem that not all healthcare systems are dealing with yet. And so we are trying to be right out there and, assisting patients. Yes, it's a problem.
I think it's another step towards the education of all of us about this, something that we don't want to think still exists. But again, you can't put your head inside of a hood someplace and say that it's not, because we hear about it more and more. I mean, I'm thinking about what happened just in the news today about that young woman from Wisconsin or Minnesota, who after several days has been found now after her parents were killed. And her name is Jamie Kloss, and she's been found alive in Wisconsin. And I was thinking about what they might find out about her, and medical care people will be some of the first that will be dealing with her. And whatever it is that she's gone through over the last 3 months, but she was found alive. And it's too early to know the details, but something like this would be something that I think would be probably very one of the first things I would be concerned about in this.
Could be.
Heather, so what do you say do people need to hear as the message of this?
Well, I think awareness, just that, it's everywhere. It's not only in other countries, but it's here. It's in Boone County. It's in Columbia. We're seeing it at MU Healthcare, and awareness is the biggest thing. Today is actually, I don't know if you knew that, but it's National Human Trafficking Awareness Day.
I did not know
this
that.
Was a pretty timely program.
Well, maybe there was a reason that it came on this date. I think I did not realize that. In the past, I've been more aware of it because I have many times talked to Nanette, and she's been very good about educating us on the issues here. But it's nice to see it practically put in a practical and pragmatic use, because if we talk about it and only talk about it and not are able to be aware of it and then know how to respond to it, then we're not doing all we can do. Tracy, anything else you want to tell us about it?
So big shout out to Nanette, because she's really who sparked this whole program. She attended a staff meeting and we went, wow, it is here in Columbia. We need to do something about it.
Amy, how about your final thoughts on this? Again, as somebody who sees it as an emergency person and a person who sees it especially in children, it breaks my heart to have you here to talk about this topic today.
I just want everybody to realize that it can happen right in front of you. The trafficker is somebody that you would expect, but somebody that you're not going to expect. It could be a parent. It could be, a grandparent. It could be anybody that is trafficking these kids and adults as well. But unfortunately, in kids, you don't see it as well because they don't feel that they're necessarily abused in these situations because they've been
what you said earlier, they've been groomed. I mean, I think that is a startling statement to say that this is all that they've known. This is their reality.
And unfortunately it is. I just hope that people become more aware and they start stepping up and calling out, and if they truly see something. It is heart-wrenching to do it in kids, but I like to think that even if I can save one, that's what I'm here to do.
Yeah, well, good. Amy, and again, is it Huff or Hoff?
Hoff.
Hoff. Amy Hoff, thank you. Heather Jones, thank you very much also. And Tracy Bocklage, thank you. Appreciate your information about what you're doing and what on National Human Trafficking Awareness Day, what the MU Healthcare is doing in regard to helping their professionals being able to identify it and then to understand what the next steps are should they come across those who are suspected of being victims of human trafficking. You're listening to News Talk 1400 KFRU.